Hello, we are Eduardo Ramirez Cuellar and Michael Arnold, and thank you for listening in to hear about research titled Age-Related Differences in Patient-Interpreter Preference. Our research was conducted at JayDoc Free Clinic, a student-run free medical and pharmacy clinic in Kansas City, Kansas, with a majority Spanish-speaking patient population. Our clinic serves around 2,000 patients per year, run by volunteer medical students and pharmacy students affiliated with the University of Kansas. We provide both non-emergent primary care and specialty care, including dental, diabetes, gender-affirming, and cardiology care, to name a few. Our Spanish-speaking patient population has access to interpreting services provided by clinic volunteers, a backup language line phone service, or otherwise may utilize family members to communicate with providers. While existing literature indicates greater accuracy from trained interpreters, often JayDoc patients elect to use family members based on their personal preference. Many disparities in patient choice for interpreting services have historically differed depending on the age and stratification of the patient. As such, this study aimed to compare age-associated differences in patient trust between use of family members versus trained interpreters in a free clinic setting. Over a 6-month period, participants completed a voluntary 19-question Likert scale survey using secured RedCap online database following clinic visits. The surveys were administered following patients' encounters with a physician. Participants completed the survey using iPads with the assistance of their interpreter if necessary. You can see a screenshot from the RedCap survey on this slide with examples of a few of the questions that were asked. Questions were translated to Spanish for patients to be able to complete the survey themselves. Participant demographic information was collected with respect to sex, race, ethnicity, and age. A statistical analysis were stratified by age, younger or equal to 40 versus older than 40. And into age groups, 20 or younger, 21 to 40, 41 to 60, and 61 plus. Among the 71 patients or participants, the average age was about 39.5 years old. The participant population was about 65% female, and the majority identified their ethnicity and race as Hispanic white. Participants were asked their concerns related to family member or interpreters' personal agendas interfering with their understanding of what was happening in clinic. Initially, we found that each age group demonstrated a majority of either neutral or agreement responses when asked if they were concerned about their family member or friend having an agenda that might interfere with their provider interaction. We were surprised to find that when asked the same question with respect to their trained interpreter's personal agenda, participants still demonstrated a concern. We believe this highlights an overall limitation to the efficacy of the patient-provider interaction when interpreting services have to be used, regardless of whether the individual interpreting is a trained professional or a loved one of the patient. Additionally, participants were asked whether they would choose to have a family member or friend interpret for them at JayDoc, rather than one of the approved interpreters offered for them. The graphics included here demonstrate responses when stratified by age groups and via comparison between participants younger or equal to 40 and older than 40. The 38 participants aged younger than 40 demonstrated no significant difference in trust level between family versus screen interpreters, with a p-value of 0.46. However, the 33 participants aged older than 40 exhibited a significant preference for the approved interpreters provided by JayDoc over utilization of a family member, with a p-value of 0.02. Results of the current study suggest age-related preferences for interpretation when seeking non-emergent preventative care at a student-run free clinic in the Kansas City metropolitan area. Findings illustrate a penchant for trained interpreters among Spanish-speaking patients older than 40, compared to no preference among ages younger or equal to 40. This may be due to improved partial bilingual communication skills in younger patient populations. Future studies may be required to assess whether the interpretation method preferable to the patients can improve health outcomes long-term. Health equity within clinics such as JayDoc that serve majority non-English speaking patients can be improved by increasing efforts to provide skilled, reputable interpretation services that foster trust among patients seeking care. We would like to give a special thank you to Dr. Alan Greiner for his assistance in the development, implementation, and analysis of this study. In addition, we are grateful for the time and effort of the JayDoc clinic interpreters in working with patient populations to obtain data for our project. Thank you for listening and enjoy the conference.